Okay, so now we are going to demonstrate the collection and transport of cerebrospinal fluid or CSF for culture. So the first thing that you need to remember is that just as in other cultures, CSF should be collected with strict aseptic precautions. Because we are invading into the central nervous system, we should take great care not to introduce any other external pathogens into the central nervous system. So therefore, we have to clean the skin in the similar manner as we did for blood cultures. So blood cultures also we initially clean with 70% alcohol, let it dry off, and then we clean with povidone iodine. So you have to do the same procedure for CSF specimen collection. Ideally, it should be collected prior to administration of antibiotics, but if it is not feasible, at least with the minimal number of antibiotics and before the next antibiotic dose is the best time to collect the sample. When you collect the sample, you have to collect it into a sterile screw cap bottle, just like the one that we have here. So this is an in-house prepared bottle we have here. So you can see that it has a screw cap. Because of the screw cap, the specimen will not leak and the specimen is secure inside the bottle. And because it's a small bottle, CSF is also a very small volume. This is appropriate for the specimen volume. So you can also collect it into a larger universal bottle, which is also sterile screw cap, but it is preferred to collect it into a smaller bottle such as this one. And something that you need to remember is that you get this type of penicillin bottles in the walls. So these are not very good containers for collection of specimens, because you can see here it has a rubber lid and it will open with a pushing of the lid towards the top side. So when you push the lid, it will invariably touch the inside of the lid and the sample will get contaminated. And even without touching, sometimes the rubber lid will fall off by itself if it is kept at just on the table. So therefore this is not a very good specimen collecting bottle. And besides, if there are any antibiotic residues in this bottle, it may also act as an inhibitor. So you should never use a penicillin bottle to collect CSF, because it's a precious sample collected from a sterile site. So once you collect the sample into a bottle like this, as for other specimens, you should label the bottle properly with the patient's details, and the details and history should be documented in a request form and sent together to the laboratory with minimal delay. And if there is a delay, the specimen should be kept at room temperature. It should never be refrigerated. Okay, so that is about CSF specimen collection.